I just want to start by saying thank you so much to the organizers of this two-day workshop for inviting Andy and I to be here in Sri Lanka. We're very excited to be here. This is our first time for both of us, and although we got in very early and it was still kind of dark, we did have a nice drive from the airport to the hotel. We're just right on the shore, very beautiful. You have a beautiful country. We do hope to see more over the next 2 days. But again, thank you so much to the organizers, especially the Ministry of Health and the Sri Lankan Association of Child Development. Happy one-year birthday to you. Dr. Pereira, thank you so much for having us here and helping organize this event. Again, we're very happy to be here. So I'm going to speak to you first this morning, and Andy will speak to you a little bit later. I'm going to give a brief overview about Autism Speaks, our mission, and then to talk about how our public health program was established and what it aims to accomplish. You might not think when you hear about autism initially as it being a public health program, but what I'll talk to you about today is the public health burden of autism and why we took the approach of establishing a more comprehensive public health strategy for dealing with autism in the U.S. and internationally, and taking it out of this thinking of autism as being just a clinical issue, a medical issue, or an education issue, and thinking about it from a multi-sectoral approach. And the importance of working collaboratively as a diverse group of stakeholders in developing strategies to helping meet the needs of local communities. So let me start just by talking a little bit about Autism Speaks' mission. It's very clear that our mission is to change the future for all who struggle with autism spectrum disorder. It's easier said than done, but that is our mission, and we aim just to do this by supporting individuals, families, and communities touched by autism around the world, not just in the United States and not just among high-income countries, but especially in working with those underserved populations from low and middle-income countries and low-resource settings, even in high-income countries. We are the world's largest autism science and advocacy organization. So I say that because I want to just briefly mention some of what we do outside of the science realm, and Andy will elaborate a little bit later about some of our advocacy work and some of the more specific activities we're doing in different countries. An outreach efforts that has a global reach. On April 2nd every year, which is World Autism Awareness Day, a UN-sanctioned day, we ask that countries around the world and communities around the world light up their landmarks and major sites in blue to get the conversation going about what autism is and to make families feel empowered that they're not alone. And we found this to be a very successful campaign. Andy will talk to you about how
avoiding eye contact is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
Maybe he's really focused.
Hey, Michael, maybe he likes spinning the wheels.
Maybe he just loves trucks.
Maybe he's just being a boy.
Preoccupation with objects is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
So this awareness campaign is trying to accomplish a number of objectives. The first is to teach families that early detection can lead to early intervention and then better outcomes. And to do that, we're teaching families some of the early warning signs of autism, and that if they have concerns about their child development, parents shouldn't wait, but they should go and speak to their doctors. So it's empowering parents to be able to come forward and speak to their doctors about what they're seeing as potential problem behaviors. The other, what we're trying to do here, which you may or may not have noticed, is that we're actually targeting ethnic minority groups in the U.S., African American and Hispanic families. We know the prevalence of autism seems to be lower in those CDC reports, but the reason we think is because less access to diagnostic and intervention services. So what we're trying to do here is target those families directly those underserved families in the U.S. to inform them about autism and also empower them to come forward. And this is part of one of our public health programs, which we call Early Access to Care. Early Access to Care is, I already mentioned that autism is diagnosed later among ethnic minority groups. Autism can be diagnosed as early as 2 years of age reliably, but still the average age of diagnosis is 4.5, and even later among ethnic minority groups. I mentioned the low prevalence, but one of the points we want to make here is that we have underserved communities in the U.S., even in a high-income country, and the challenges that we see in working with underserved communities are actually very similar, if not the same, across different countries. And so we use strategies that may work broadly in different communities around the world. And in terms of early access to care, the objectives are to decrease the age of diagnosis and increase access to early intervention services. And we do this in a coordinated approach where we work with local stakeholders in the community, we work with parents, we work with care providers to educate them about early warning signs, and then we try to help connect families to services by building capacity for services, but also by helping them navigate what can be complex systems. And I mentioned already the Maybe campaign, which was what has been so far a relatively successful approach in reaching some of these ethnic minority groups and underserved families here, families in the U.S. So what I'm trying to get at here is that autism is a global challenge. It transcends ethnic, cultural, economic, and geographic borders. And as awareness increases, well, so does the demand for support. And so even though we're talking about drastically different communities, the challenges may in fact be the same. And the barriers to progress are limited awareness, stigma that families may feel, also the lack of expertise and capacity, and the lack of public health data statistics to really help inform policy development to establish programs that will help families in overcoming some of these challenges. So what you heard about our Early Access to Care campaign actually relates directly to our Global Autism Public Health Initiative, where it is a coordinated strategy that helps us raise public and professional awareness of autism, not just public, but also professional. We want to educate doctors about what autism is, as well as educators. It helps us establish public health statistics of the prevalence of autism, the cost of autism in different communities and countries around the world. And then, of course, the third part of our Global Autism Public Health Initiative is to develop capacity for services. And this slide here describes all these activities a little bit further. GAPH was actually launched back in 2008 around the first World Autism Awareness Day celebration. And Autism Speaks' role in the Global Autism Public Health Initiative is to serve as a facilitator and technical advisor. I'll talk about the core values in a moment, but one of the key aspects of our Global Autism Public Health Initiative is that it enlists local leadership and builds on existing efforts to help overcome the challenges and the needs that are described to us by the local community. So Autism Speaks doesn't go into a community and says, here's what you need to do. What we say is, what are the challenges you're facing, and what can evidence-based science tell us that can help us develop meaningful, culturally sensitive strategies for helping families in the community in a way that's very accessible and affordable. I mentioned the three parts of GAPH are to raise public and professional awareness, support scientific research, specifically in getting public health statistics, and also the service development aspect. In terms of service development, we're looking at innovative strategies to reaching families. So this is not just the training of highly specialized professionals, but it's going into the community and working with parents and community health workers to train them in being able to identify early warning signs and diagnose autism, as well as provide basic services. The other element of this is that this doesn't just work for autism. A lot of the autism services in terms of diagnosis and intervention actually transcend multiple developmental disabilities. And so elements that we are working with in terms of autism can also be meaningful and effective for other developmental disabilities. The core values of GAPH are, well, one, to have a sense of urgency. We know families have challenges today and are demanding help today. So we're not just talking about early detection of families that have yet to be diagnosed, that have children that have yet to be diagnosed. It's also working with families that have children or adults with autism today and giving them meaningful solutions. By using a human rights foundation by embracing differences and seeking out the shared priorities among a diverse set of stakeholders. So we work in an inclusive fashion where all of the local community members who are involved with autism, from parents to parent organizations and professional societies, we want to know what challenges each group is facing and look for the commonalities so we can develop solutions that will have the biggest impact in the most immediate fashion. We mentioned we use evidence-based approaches. For example, there is science that is supporting the use of parent-mediated or parent-delivered interventions and being able to effectively manage and treat autism. So that's taking treatment out of the exclusive hands of highly trained professionals and getting services to children by working with parents who spend the most time with children and making that time that a child is in the home a time for learning or time for receiving autism intervention, where, again, you're not going to be able to go to a highly trained professional for 40 hours a week. We're very sensitive and have respect for the values of different cultures. Obviously, everything that's developed needs to be culturally sensitive and meaningful. The idea, as I mentioned, is to support local leadership and thinking about solutions in terms of their feasibility, cost effectiveness, and really important here is sustainability. So we don't want to help the Sri Lankan community, for example, develop a program that will only last for a short period of time. We want a program to establish a foundation for a longer lasting and broader reaching program, for example, by training trainers so that the system can, in a sense, perpetuate. And that's why it's so important that we work with governments, because we want these programs to be sustainable over the long term, and we feel that working with government will allow us to do that. And then, most importantly, is having measurable benefits to individuals and families. We want to evaluate these programs. We want to hear from the families that are receiving the services to make sure that they're meeting their needs. And it's adaptable over time. So this is our Global Autism Public Health Initiative. Currently, we're working actually in over 50 countries around the world. The map needs to be updated, but there are a number of different strategies for implementing GAPH. One is at a national level. And really, we need to start at a national level so we can understand the specific needs of a specific community. But also, we like to work in a regional fashion because neighboring countries often have similar challenges, often have similar cultures, similar customs, similar health systems. And so we think, especially in resource-scarce areas, that working in partnership with countries in your region can help accelerate the pace of development of public health programs for families. And we've seen success in using this approach in Southeast Europe and the Gulf Coast countries, and actually here in South Asia through our South Asian Autism Network that Sri Lanka has been a participant in. Andy will speak about our regional approach and some of those networks a little bit later when we go into the country-specific and regional-specific efforts. And I just want to conclude here by offering a way forward. We think there's a real global opportunity here with the recent WHA and UNGA resolutions to really focus on mental health as being important to the development of a country socially and economically. And we think the Global Autism Public Health Initiative provides a strategy for helping improve the lives of individuals affected by autism, developmental disabilities, and other mental health challenges. Autism Speaks is here to help. Here we are in Sri Lanka. We're really happy to be here. And what we're here to do is really to offer our technical guidance, talk to you about the current state of autism science in terms of scientific evidence for developing programs, and also to offer our expert network of researchers and professionals and trainers that we've been engaged with internationally through our global initiative. Also, we're here to offer our toolkits, our materials. Everything that appears on our website is available for free and can be translated into local languages. And also, we're here to request your help in continuing to raise awareness of autism around the world. For example, through our World Autism Awareness Day, Let It Up Group campaign on April 2nd. And so, we're really excited to be here again over the next 2 days to talk about a possible way forward through GAPH here in Sri Lanka, but also thinking about Sri Lanka's role in a regional network, in the South Asian Autism Network, and then to talk specifically about the implementation of the resolutions, what Sri Lanka can do to lead in the region, and lead around the world, and what Autism Speaks can do to help. So again, thank you for having us. Thank you so much. And we look forward to having a dialogue with you over the next 2 days. Thank you.